Diagnosis according to Zhang organ patterns. We will discuss extreme heat generating liver wind. Liver wind can arise as a consequence of four different imbalances. Extreme heat in the whole body, for example, when a fever creates blood heat, which then creates heat in the liver. Chronic ascendant liver yang, which will often be the cause of liver wind in elderly patients. Liver blood deficiency, where liver blood, which is an aspect of liver yin, is not able to anchor liver wind, which is an aspect of liver yang. Liver fire, where the fire burns so intensely that it generates wind. Wind in the body is similar to climatic wind in several ways, and it can be just as destructive. It can be as mild as a light breeze and cause only mild symptoms, such as tics or a slight dizziness, or it can be as wild as a hurricane and cause paralysis, spasms, and a cerebrovascular accident, particularly when wind is created by heat. It can be very destructive and sometimes even fatal. One of the dangerous aspects of wind is that it can stir up phlegm, swirl the phlegm up to the head, and block the orifices. This will cause the person to lose consciousness and the ability to talk and make the tongue stiff. Phlegm can also block the channel, so the person becomes paralyzed. Some of the disorders in Western medicine caused by internally generated wind are meningitis, tetanus, febrile convulsions, epilepsy, and a stroke. Wind can create a gentle movement like a flag fluttering gently back and forth on a summer day, but it can also make the same flag stand rigid and stiff in the air, moving to neither one side nor the other, as in an autumn storm. In both cases, it is characteristic that the movements are involuntary, and this is also the case in the body, with all involuntary movement of the muscles, twitches, cramps, and spasms being due to wind. Extreme heat generating liver wind. If there is extreme heat in the body, such as when there is an invasion of exogenous pathogenic qi, for example, the pathogenic qi can generate so much heat that it affects the liver, with the heat in the liver generating wind. This is comparable to a forest fire. When there is a forest fire, the hot air will rise upwards. The vacuum this creates will draw in the air in from the surrounding area, and this creates a strong wind that rushes upwards. The symptoms of this imbalance will be acute, and they will often be extreme. In Western medicine, diseases such as febrile seizures, tetanus, and meningitis fall within this category. Exposure to exogenous pathogenic factor is the main cause of this pattern. If there is already heat present in the body or the person is yin deficient, this pattern will arise quickly. This is typical in babies as they are relatively young with a warm constitution, but their yin is weak. They therefore have a greater tendency to develop febrile seizures than adults when there are invasions of exogenous pathogenic qi. This means that they are very vulnerable when there are epidemic diseases. Symptoms and signs: high fever, extreme thirst, red face, the skin feels quite hot when palpated, dry, red lips, seizures, muscle spasms, extreme stiffness in the neck and back. The back can be stretched and bent like a bow. Involuntary clenching of the hands and toes, shaking or involuntary movements of the limbs, such as in epilepsy. The jaw may be locked. In extreme cases, the eyes may be closed, staring or upwardly staring. Extremely red tongue that is stiff and motionless, possibly veering to one side. There will be a dry and yellowish or black coating, rapid and wiry pulse. Key symptoms are tremors, spasms, high fever, and a rapid, wiry pulse. Treatment principle: calm liver wind and drain heat. Acupuncture points: we choose from liver 2, liver 3, Sichuan, Jing well points, do 8, 14, 16, 20, GB20, and LI11. Dental technique is draining. Sichuan and Jingwell points should be bled. Liver 2, liver 3, and do 8 calm the liver and extinguish liver wind. Sichuan and Jingwell points drain blood heat and extinguish internally generated wind. Do 14 drains the fire and extinguishes internally generated wind. Do 16, GB20, and Do 20 extinguish internally generated wind, especially when the symptoms affect the head. LI11 drains heat. This is an acute condition that is caused by an invasion of exogenous pathogenic Qi that has penetrated to the blood level. Dietary and lifestyle advice are therefore of less relevance. Extreme heat-generating liver wind can be caused by invasion of exogenous pathogenic factor, and it can result in phlegm wind. To summarize, the etiology of extreme heat-generating wind is invasion of exterior heat or wind heat penetrating to the blood level, generating internal wind. Underlying accompanying pathology, this pattern is only encountered with acute febrile diseases. Possible presenting conditions are measles, encephalitis, meningitis. Signs and symptoms: high fever with thirst, red face and eyes, convulsions, rigidity of the neck and back, upward staring eyes, clenched jaw, tremor of the limbs, in severe cases. Pulse, widely rapid, tongue, deep red, stiff, dry yellow coating. Treatment principle: calm the liver and extinguish wind, clear heat. Acupuncture treatment: GB20 extinguishes interior wind, Li11 subdues hyperactive liver qi, Heart8 quiets heart, regulates spirit, Liver2 clears liver heat, extra point Sichuan clears heat, extinguishes wind, 220 extinguishes interior wind. Liver3 dispenses liver, subdues wind, Pericardium 8 extinguishes wind, cools blood, 2-8 extinguishes wind, relieves spasm, 2-14 extinguishes wind, clears heat, SI3 extinguishes wind from governing vessel, 2-16 extinguishes interior wind. We needle with drainage and prick 12 well points to bleed. Thank you so much for listening.